If you suffer from foot or ankle pain, you might be wondering, what type of health practitioner should you be seeing? Well, luckily in our office, we treat lots of foot and ankle pain. My name is Dr. Robin Armstrong. I'm a chiropractor at Willowbrook Chiropractic, and today I'm going to demonstrate some of the treatments we might use if you come to us with foot or ankle discomfort. Now, of course, we always start with a thorough history, trying to understand the root of your problem, how you got to where you are today. And then, of course, an examination. We might look at the bones of your foot, of your ankle, higher up in the shin, the knee, the hip, and the low back to make sure that the source of the problem is actually coming from the foot and ankle itself, or maybe it's coming from higher up the chain. When it comes to treatment, we have a variety of tools that we might use. So I might use my hands to mobilize the bones of the foot, to adjust the ankle. There's two areas in the ankle we might adjust, so I might pull on the ankle and do an adjustment to the ankle joint itself. Or sometimes I use this tool. It's called a toggle board. It just pops up a little bit, and I might place your foot on it, do a little pull and a tap to get some movement in one of those ankle joints or in the little building block bones in the middle of the foot that often get tight or jammed. We want to address the muscles and soft tissues of the foot as well, and higher up into the shin and the calf. So both Dr. Freedman and I are trained in a technique called active release technique, which can be helpful for the muscles or the plantar fascia that runs on the bottom of the foot. So usually that would involve taking the muscle or the tissue from a shortened position, adding some pressure, and then lengthening it, and then repeating that a few times. Now, if you do think that you're suffering from plantar fasciitis, you might want to check out my video all about plantar fasciitis to learn more about that specific condition. Sometimes we might use the impulse tool. I like to use it actually on the fibula bone. So the fibula is the outer ankle, and it actually starts up near the knee. So I might often use the impulse there to get that joint moving a little bit better because it's impacting down at the bottom of the ankle. Of course, if we found anything in our exam, like issues with your knee, your hip, or your low back, we would treat those areas as well. Now, we'd also give you recommendations for either stretching or strengthening exercises you can do for the foot or for the calf or maybe even for the hip, so that can help support the treatments that we're doing in our office. And maybe you're a candidate for custom foot orthotics. Not everyone is, but it might be the right choice for you. And so that can be something that Dr. Freedman can help you with. And he's done a whole video all about foot orthotics if you want to learn more. If you are suffering from foot or ankle pain and you'd like to come see us, you can book online at willowbrookchiropractic.com. We post regular content, so feel free to subscribe on YouTube under Willowbrook Chiropractic, as well as on Facebook and Instagram. If you have any questions about what I've talked about here today, please feel free to ask myself, Dr. Robin Armstrong, or Dr. Jody Freedman. We're always happy to help.